The Mind Fitness Doctor, medicine for your body, mind, and soul. Mindfulness based yin yoga, coaching, and courses. So, welcome to day two or session two of the Stress Reset for Women in Medicine. These easy evidence based self care practices that you can use in your busy day to manage stress and prevent burnout. So, uh, As I introduced myself before, I'm Dr. Robin Charlton. I'm a perinatal psychiatrist, mindful self-compassion meditation teacher, and yin yoga teacher. Really passionate about who cares for the carers from a personal experience when I was a medical student, as I discussed yesterday, and I had my own journey from burnout to relative balance and have developed the mind fitness method for self care through this in my experience as a psychiatrist, as well as before I did psychiatry, doing neuropsychology and nutrition. So, being really interested in lifestyle psychiatry. So, today, what we look at is when stress becomes burnout and what causes it, and the letting go practice. So, basically, the rationale behind the practice that we're doing today. And so, what is stress? You probably all know a little bit about this. It involves our reptilian nervous system, our vagal nerve, which function is avoidance of harm through flight, fight, or freeze. And as we discussed yesterday, stress is our response to a perceived threat when we don't think that we have the resources to deal with it. So it can be energizing and work to our advantage, so increasing attention and interest as we see optimal performance when there is a balance between the sympathetic and the parasympathetic nervous system, and our performance is maximized. But there is a point, so that's when we play our edge, when we feel that the threat overcomes our resources to deal with the threat, and we go into sympathetic overdrive and into our parasympathetic dorsal vagal nerve collapse. So, as we discussed yesterday, we have that zone of green zone of safety, the Porges' polyvagal therapy, where we have that ventral myelinated nerve, the parasympathetic rest and digest. And then we're going into that zone of challenge, which we also had before, where the sympathetic and the ventral parasympathetic nervous system are in balance, that heart rate variability. And then we go into that zone of overwhelm, where we have sympathetic overdrive, the fight or flight, and that dorsal vagal freeze or appease. And so, what we're doing is that we are becoming aware of playing that stress edge and developing resources to stay in that zone of challenge. So, here we have that green zone, we feel safe and we're open to social connection and play. So, it's related to when we're not feeling safe, we do not socially connect. Mobilization, we can still socially connect when we have that ventral vagal nerve playing as well along, and we have that heart rate variability. But as soon as we go into the sympathetic overdrive, we disconnect from social connection, and that immobilized dissociation in response to an extreme threat, where we shut down and we are unable to move. And so basically, burnout happens when we are in this zone, this red zone of overwhelm chronically. And it's conceptualized as resulting from chronic workplace stress. And so we have this emotional exhaustion or energy depletion. So I must soldier on, but I actually have nothing to give. And I remember that feeling, constant need to soldier on. So it's related from that sympathetic overdrive, really. And then that depersonalization, so feeling of that increased mental distance from your job, not kind of feeling the satisfaction that you used to get from your job, feeling a bit disconnected from why you're doing this job. Um, that freeze, that hyper is probably the freeze aspect of that, being in that in that red zone, and that sense of reduced accomplishment and irritability. So we've gone, it's that sympathetic overdrive where we've gone over that zone of where we're at our increased productivity because we're always in that sympathetic overdrive, and no matter what you do, you feel inadequate in your role. And there's a lot of stigma about this around medicine because of the focus on the fact that what happens is that there is increased medical error, people don't turn up to work, there's not as much productivity, and then there is this unexplained resignations and retirements. And in the United States, they started calling it the Great Resignation. And as you can be kind of aware, that there is an overlap with anxiety, depression, mood disorders, and suicide. So the way that it's been measured is mainly by the Maslock Burnout Inventory. And the research that I've looked at is that it's twice the rate of the normal working population. So Yates et al. In 2021 looked at this MBI in 15,000 people and found that the rate pre-COVID was 42%, and post-COVID it's gone up to 50 to 55%. But this is also confounded by the culture of medicine, the stigma for burnout, and the fear of repercussions. Actually, the rate might be a little bit higher. Susie McAlpine, in her book, surveyed talked about how 300 doctors in New Zealand were surveyed by MPS, and that the half of them had considered leaving medicine. And Yates et al. Found who are the people that are burning out, and it's all professions, surgeons included, but it may be increased in primary care, emergency, and psychiatry. Interestingly enough, it was the same between men and women pre-COVID, but has increased in women post-COVID. It may be due to the many caregiving roles in this 40 to 54-year age group, which is where I was when I burnt out. I had in that sandwich generation between older caregiving for older parents and young children. So it might be that multiple caregiving roles and that perfectionism that's associated with that. And so when our nervous system is looking for threat, it looks for external factors that are causing threat. And so the external factors that cause the burnout really are systemic factors, but there can be individual factors. It can be the fact that we feel like we're not getting enough reward for the effort that we're putting into our work, that we have sleep deprivation, and that we don't actually have much social support. The systemic factors that should not be overlooked in burnout is that overwork, especially being increased with the pandemic, technology and the use of that information technology, and whether it's up to date and how much it helps or hinders, the lack of control or autonomy in the workplace, and this was definitely a factor for me, not having any kind of say over your diary or what you do. The moral injury and the values, like being able to not provide the evidence-based medicine that you would like to be able to provide because of funding difficulties or overwork. The COVID-related pressures definitely have been increased with having to wear PPE and different kinds of pressures that you can all relate to that we didn't have pre-COVID. The insufficient rewards we talked about, the absence of fairness and equitable workloads, and that sense of isolation that we can sometimes have especially when we're working by ourselves and not with collegial support. So the protective factors have been having like a director of wellness and a charter for doctor wellness. This is all through, they looked at it all through America. I don't know whether we have such a thing in New Zealand. The decreased workloads, decreased barriers to normalising burnout in the workplace, support from peers, support at home, good sleep, mental health support, and then there's also these micro self-care practices. Kristen Neff did a study on mindful self-compassion in healthcare and found that these micro self-care practices decreased burnout and increased the supportive culture of the workplace. So we also have that internal causes of burnout, and we alluded to that before. It's kind of like the inner critic. How we talk to ourselves can put us into that red zone of overwhelm. I found this really interesting when I kind of clicked with this. So the internal critic is like we're beating ourselves up, or we're fighting with ourselves all the time. We should have done better. Why did we do this? And then the flight part of it is that we feel that when we're beating ourselves up, that we're not good enough, that we're the only ones in the world that ever feel like this. And then the freeze is that how we could become kind of stuck to our thoughts. We could become stuck in rumination. And so that's the internal factors of how we can contribute to burnout, how we can become our own hardest self-critic, and that doesn't help us in the long run. And then the in-between, sorry, this is not been like this when I wasn't presenting it. So it's that co-regulation. So we have got mirror neurons in our brains that talk to others. So our nervous systems are basically talking to other people's nervous systems around us. So it's quite interesting when we work in teams, when we are in relationship with our patients. And so basically we feel other people's, when they are in distress or in that sympathetic nervous system, we feel their feelings. And so it's that process of resonance. And so we can, when we're feeling stressed, we're not just feeling our own stress, we're feeling the stress of other people around us, as well as the people that we are caregiving for or for our patients. And this can cause vicarious traumatization if we're not aware of it, and if we don't learn strategies to self-regulate so that we can co-regulate more effectively. So basically, we're learning strategies to find our ventral anchors, to calm ourselves, to find that area of calm, then we're actually self-regulating, and then we're helping other people to self-regulate through that process of co-regulation. So we can have that downward spiral where there's a lot of negativity, and I'm sure you have all felt that in teams and in systems. But then you can also have that upward spiral when you feel calm and grateful and positive, and that can affect other people around you as well. So it's not selfish to self-care with these micro self-care practices. In fact, it's essential to stop and be aware of what your stress is not just your own stress, it's that empathetic distress of other people around you. So it is finding those ventral factors through micromind, those ventral anchors. So finding that parasympathetic calming nervous system so that we can then start to rewire our brain and form other resources to help us stay in that zone of challenge. So there's been some studies by Fessel and other people that have shown that for healthcare, it's essential that we have these micro self-care practices, because we don't necessarily have time out to, have a daily meditation practice or a yoga practice, although that would be great if you have that too. But that this is just as effective. And we talked about crystal meth before. So yeah, so the way that we can play the siege is what we talked about before, the mind fitness method of self-care, those 7 steps to soothe your nervous system and find your calm, contentment and connection. And it's delivered through the micro mind fit practices. So SOAR is how we become aware of that stress edge and what our self-care battery levels may be. And the ing is how we can then look at how we can recharge our self-care batteries through the practice of savoring. And so we're coming now to the letting go practice. Today's been a little bit longer because we talked a lot about the theory of burnout. But it's all about kind of the letting go practice. So letting go from that stress edge, finding yourself in that zone of overwhelm and being mindful of that, and then having a practice to deal with that. And so the reminder or the trigger for this practice could be as you go through doorways between patient consultations, when you wash your hands, before you write your clinical notes, waiting for coffee, eating your lunch. Maybe you would like to set a timer, or maybe you'd like to download these pictures that I have and use them as a screensaver. And so as you go through your day, it's about taking a patient pause. And so as we did yesterday, it's about feeling the soles of your feet, or you could also feel the sensations of your hands if you're washing your hands, to use an anchor to bring us into the present moment. And then feeling the sensations of your breath, and then letting go of the experiential distress on the exhale. So being aware that where you're feeling stress in your body, maybe you feel a bit of tension or tightness that you identify as being stress, and then kind of letting go of it on the exhale, and maybe trying to extend your exhale, because we know that inhale activates our sympathetic nervous system, and the exhale, which is our yin breath, activates the parasympathetic nervous system. So yeah, just to remind you again, feel the soles beneath your feet. Your soles of your feet are your anchor throughout this week. So use that as a way of anchoring yourself into the present moment. Become aware of stress, maybe where you're carrying it in your body, some tension, and then recognizing that it is experiential distress of others as well as your stress and your response to it. We used we do talk about this as transference and countertransference in psychiatry. And then exhale to let it all go, and try to extend the breath as possible to find your calm. And then this is how you can work with me. This is how I'm trying to set up an 8-week course called the Mind Fit Doctor, which is the mind fitness method of self-care, basically going through each of the 7 steps to self-care. We've got the mindful self-compassion courses, and when we've got the mind fitness gym, where this will be available for you for lifelong after these weeks, if you'd like to join the mind fitness gym, which is basically lifestyle psychiatry delivered through our 4 walls of wellness. Look at physical things such as diet, exercise and sleep, how that affects our mental health. Then the stress, which we're doing this month, mindfulness, self-compassion and gratitude, and then how communication, boundaries, the social wall, and then the spiritual wall is what nourishes our soul and what gives us purpose and meaning. And so just to end this practice now, again today, May I accept the things I cannot change. May I have courage to change the things I can. And may I gain the wisdom to know the difference. If you want to find out more about mind, fitness, yin yoga, coaching, and courses, then visit my website and app at mindfitnessdoctor.co.nz. This is where you can join the Mind Fitness Gym, which is the only gym for the mind where you will receive medicine for your body, mind, and soul. Namaste.